About to start. Hello, sir. Uh, Good morning, sir. Today we would be discussing the effects and treatments of smoking. Now, sir, welcome to this class. I am your student health instructor. My name is Carl Jonas. May I name your name, sir?
My name is Ricardo Diones.
Okay. Hello, Mr. Ricardo. Uh, so today we would be after this session. We would expect to see results and acknowledgement on the latter part. Now, sir, let us begin. Just wait for a while as I share my screen. Can you see the screen, sir?
Yes.
Okay. We will now begin with the effects of smoking. Now, introduction. What is smoking? Smoking is the definition of the smoke of burning tobacco encased in cigarettes, pipes, and cigars. Now, casual smoking is the act of smoking only occasionally, usually in a social situation or to relieve stress. A smoking habit is a physical addiction to tobacco products. Now, many health experts now regard habitual smoking as a physiological addiction too and one with serious health concerns. Now, smoking is a phenomenon that has spread in many countries of the world and have expanded circle of this phenomenon to include millions of individuals from different social levels and all ages. Now, after that, we would be discussing what happens to your body when you smoke. Now, smoking causes cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary diseases, which includes emphysema and chronic bronchitis. Now, smoking also increases risk for tuberculosis, certain eye diseases, and problems of the immune system, including rheumatoid arthritis. Now, other effects are mental health problems, vision changes over loss, raises overall cancer risk almost everywhere in the body. So it also increases the risk of heart attack and heart disease. Stroke risk increases psoriasis risk, diabetes type 2, and osteoporosis. It may also affect your fertility problems and delayed wound healing. So now, after that, we would be discussing to the types of smoking. Now, cigarette smoking is the use of common form of tobacco worldwide. But other than that, there are a lot of tobacco products that includes water pipe, tobacco, various smokeless tobacco products, cigars, cigarillos, roll your own tobacco, pipe tobacco, bidis, and critex. Now, there are also other form of smoking such as e-cigarette which has become a trend in today's society. As you've noticed, everywhere you look, there seems to be a lot of vape shops and cigarette hobbies where you can find cigarette products and such. Uh, Smoking nowadays is still um is still a norm. Now, some people would rather avoid smoking. After that, now let us discuss the symptoms of excessive smoking. Now, as you've noticed, when you smoke excessively or often, you would notice that you are experiencing nausea, you vomit, stomach ache, loss of appetite, increased rate and blood pressure, headache. You've noticed that your mouth's watering. You have trouble with you are experiencing breathing properly. You are experiencing dizziness or tremors in your hand, confusion and anxiety, diarrhea, shallow breathing, slower heartbeat, and blood pressure. You may also experience extreme fatigue, weakness, slow reflexes, or unable to control muscles, and pale skin. Now, diagnosis. The effects of cigarettes to your lungs and airways. Smoking causes significant changes in your lungs and airways, which are sudden, lasting just a short time. Some changes are sudden, lasting just a short time, such as colds and pneumonia. Others are more chronic changes that happen slowly and can last a lifetime, like emphysema. Here are some changes that happen in your lungs and airways when you smoke. Now, when you smoke, more mucus and infections are tend to happen. The cells that produce mucus in your lungs and airways grow in size and number. Now, as a result, the amount of mucus increases and thickens. Your lungs cannot effectively clean out this excess mucus, so the mucus stays in your airways. Now, it clogs them and makes you cough. The extra mucus is also prone to infection. Smoking causes your lungs to age faster and hinders their natural defense mechanism from protecting you against infection. Now, less airflow. Smoking inflames and irritates the lungs. Even one or two cigarettes cause irritation and coughing. Now, smoking also can destroy your lungs and lung tissue. This decreases the number of air spaces and blood vessels in the lungs, resulting in less oxygen to critical parts of your body. Now, fewer cilia. The lungs are lined in broom-like hairs, like cold cilia, which clean the lungs. Now, a few seconds after you light a cigarette, cilia slows down in movement. Smoking just one cigarette can slow the action of your cilia for several hours. Now, smoking also reduces the number of cilia in your lungs, leaving few fever, leaving fewer to properly clean them. Now, management, how to quit smoking. To successfully stop smoking, you'll need to address both the addiction and the habits and routines that go along with it. But it can be done. With the right support and quit plan, any smoker can kick the addiction even if you've tried and failed multiple times before. Now, sir, in this segment, I will be teaching you, or rather advising you, on how to stop smoking. First of all, pre-contemplation and contemplation. Uh, d- has it ever occurred to you to quit smoking before?
Yes.
Yes, that is the phase where you think about smoking, but you are not able to, and you might find it difficult and return to bad habits. But that is a good thing that you acknowledge it and you accepted that fact that smoking is bad. After that, you will be proceed to preparation. Now, in preparation, you will be planning how many cigarettes do you take in a day, and how many pesos do you consume per cigarette. Um, can I ask, sir, how much is one cigarette?
One cigarette costs 9 to 10 pesos per stick.
9 to 10 pesos per stick. And how many cigarettes do you consume within a day?
Maybe 3 to 5 stick per day.
So with 3 to 5 sticks per day, you averagely consume 50 pesos a day. Now, if you times 50 for a week or for 5 days, it costs 250, which is a rather large amount. Now, if you if you see, uh, when you quit smoking, you would save a lot of money, and that will be concluded in the preparation. You take note of your dosages. I mean, your how many did you consume, and your time intervals for every stick. Now after that, you'll begin to plan. You will begin with action, and now in action, it will be implementing your planning, and that would be lessening your cigarette sticks. For example, you're consuming 5 sticks per day. You would try to lessen it by only doing four, and after that, you would try it for 1 week, and for the next week, you would only consume 3 cigarette sticks per day. Now, after that, you will begin with the maintenance, which is remaining a non-smoker. After you slowly change your routine and your habit, you will now seek to maintain it by monitoring yourself. I know that quitting might be hard, and sometimes it might be impossible, but with a certain type of support and from friends and family, you will be able to quit the habit entirely. Now, let us discuss the prognosis of smoking. Now, overall mortality among both male and female smokers in the United States is about 3 times higher than that among similar people who never smoke. Now, the majority causes of excess mortality among smokers are diseases that are related to smoking, including cancer and respiratory and vesicular disease. Now, smokeless tobacco is a known cause of cancer. In addition, the nicotine in smokeless tobacco may increase the risk for sudden death from a condition where the heart does not beat properly. Now, after discussing this, sir, may I know what is your actions and what is your reaction uh, on my health session?
Uh,
Do you plan to
napag-isip-isip ko
quit,
na,
sir?
yeah, I also plan to quit, and napag-isip-isip ko na, yun nga, mas makakatipid ako 'pag ano, 'pag tinigil ko magsigarilyo.
Ah, I see. That's good to hear, sir. Now, uh, I am very glad that you've taken that path. Now, thank you so much for cooperating with me. And after this, uh, after this session, I will be monitoring and coming back to you for your results and improvement. Thank you so much, Sir Ricardo Jones.
Thank you.